Mississippi Delta, the area that gave birth to the blues, the home of Delta State University, and a wonderful, lush environment perfect for farming and hunting. Though the Delta is a marvel with a lot to offer, the need for proper health care is even more crucial in small rural areas, particularly in the Delta. For example, the current obesity rate is over 35% in Mississippi. Mississippi has the nation's highest teen pregnancy rate. An estimated 373,000 adults in Mississippi have diabetes, and that number continues to grow. And our poverty level is over 20% in Mississippi. This means that small areas like Ruralville, Mississippi, demand a higher need for both healthcare and economical drivers to survive. They can benefit strongly with a proper healthcare center. First, people don't have to drive hours away to receive quality medical attention. Next, a healthcare hub can provide much-needed jobs, which means that the unemployment rate will lower and give those hardworking people in the town jobs.
Small rural hospitals are doing outstanding work in our state and so often go unnoticed because they are small rural hospitals. They are access points for health care in their communities, which is extremely important in moving forward in health care in general and providing population health and managing the care in the communities.
Deep in the cornfields of the Mississippi Delta, there's a buzz in a small community that continues to grow. Also known as the Little Hospital That Could, North Sunflower Medical Center receives much-deserved praise for reviving the state of the economy for the town of Ruralville, Mississippi. With that said, let's take a look at how a small hospital like North Sunflower has had a huge impact on a now thriving community.
The neat thing about what goes on at North Sunflower, it's not that we're doing things that other people aren't doing, they're just not doing them in the rural setting. You can go to Jackson, Memphis, Tupelo and get what we offer, but you can't in rural Delta setting, the other rural areas of the whole country. And we're making a difference by being there.
North Sunflower Medical Center has had a tremendous financial impact on Ruralville and the surrounding communities. We've got people driving in to work at the hospital from many areas, but what they do is they come and they purchase gas, they buy things in the stores around here, and it's really given Ruralville the economic boost that it desperately needed.
Year after year, North Sunflower Medical Center continues to add to its already impressive foundation with services such as a swing bed, X-ray center, pharmacy, senior care, diagnostic center, extended hour clinic, and many more. You can take care of all your medical needs in one place.
The individuals that work with me and us at North Sunflower Medical Center have the insight to offer and to bring in these innovative services to serve a rural community where they would have to travel 2 to 3 hours otherwise to receive these types of services.
For now and over a decade, North Sunflower Medical Center has prided itself in innovation and new technology. Things that were once only available in bigger cities are now flourishing in this small rural hospital. Though the hospital has been around since the early 50s, it wasn't until about 11 years ago when Billy Marlowe came along with one goal in mind: to revitalize the healthcare system for the benefit of the people in Ruralville. Marlowe wanted the hospital not only to be great, but better than its competition in surrounding areas.
I did a survey. The first thing I did is tell me what's wrong, tell me how to fix it, and really the employees fix this.
In doing so, it would motivate people to drive to their local medical provider with confidence that they would receive the proper health care they needed.
Just to give you a little background, maybe 15 years ago, North Sunflower was having its ups and downs. People in the rural community would tell you instantly, take me to Cleveland, take me to Clarksdale. I don't want to go to Ruleville. But Mr. Marlowe came aboard, Billy Marlowe, who's now our executive director, and with his guidance, North Sunflower has turned around.
It's a unique hospital. If you look at the hospital itself, as far as the environment, as far as the size of this facility as compared to the community that's in, you would kind of step back and wonder how that existed. I think one of the best things about this hospital is the administrative team, the people who actually put this hospital together over the last 10 years and has made it what it is today.
We see that North Sunflower Medical Center boasts a happy staff, new and innovative equipment, and top service that can't be matched. But there must be a reason for this. Sam, the current CEO, has had a passion for his job since he started working for the facility 13 years ago. He stresses the notion that he works with his family. This means that the employees feel right at home as soon as they punch in.
Everything at North Sunflower is based on the 3 solid principles of a very clean environment, a smiling face, and good food. That hasn't changed over the last 10 years. That's our culture. It's built into our culture. Everybody is a housekeeper. Everybody helps to take care of the building. Everybody helps take care of the equipment. Everybody absolutely really understands that our patients, without them, we wouldn't be here. We're a little different. There are a lot of great healthcare providers in the Delta. I'm always aware of that. We at North Sunflower are very aware of that, very respectful of it. We try to be that one that is different enough that when you walk in the door, you leave that door knowing that you've been treated with respect, professionalism, courtesy, and given the best we have to offer. Every day, every person, every place.
North Sunflower Medical Center has a strong reputation for listening to the community. Soon after there was a need established for a pediatric center, the hospital responded quickly, and in came Dr. Sally Ann Jessie Ganpot, the center's pediatrician.
North Sunflower Medical Center means a great deal to the people of the Delta. All communities that surround here, Bolivar County, Coahoma County, Humphreys County, Tallahatchie, use, especially I know, North Sunflower's urgent care clinic as their after-hours go-to spot. Before I even came here, many of my patients used North Sunflower's clinic for their after-hours care. And then they would come and see me afterwards. And they got very good care. Okay, a lot of what I would do as a doctor was already done here.
Of course, the medical center would not have survived if it wasn't for the caring and inspired people in the town of Ruleville.
Ruleville is a small community with a lot of love. What I mean by that, Ruleville and North Sunflower, what they have in common, you might not deal with a person on a day-to-day basis, but if something occurs, you see this community come together, whether it's sickness, death, marriage, birth of a child. You would be surprised at the people that flowers you, because you would think, I see you every day, we speak, but then when something happens, you look up and half of the community is at your doorstep.
The Mississippi Hospital Association is proud to present the Outstanding Rural Hospital Award to North Sunflower Medical Center because we know how hard they've worked and the quality of their services and their value to the community.
Well, there you have it. North Sunflower Medical Center is a perfect example of how a small rural area can grow tremendously thanks to the strong administrative team, a motivated staff, and the smiling people in the community. I believe we'll continue to hear great things about the town of Ruleville and always hear the sweet sound when someone says,
"Take me to Ruleville!" Take me to Ruleville, back to the folks I know.